In this video, we're going to see about the introduction and pathogenesis of the ectopic pregnancy. This video will be the part 1 session of the ectopic pregnancy. In this video, we're going to see about the introduction. What is ectopic pregnancy? Ectopic pregnancy means that the implantation of the ovum or the embryo is apart from the uterine cavity. That is called ectopic pregnancy. Usually the site will be the most common site will be the fallopian tube, and there will be subsequent site will be the ovary and the broad ligament and the ovarian ligament and the lower part of the thing, and it may go into the peritoneum or the abdominal cavity itself. And there will be the intramural implantation that is the site of the insertion of the tube and the uterus. That is a function is called as intramural, where the implantation is occur, and we can able to identify later period of the USGs, so that the embryo or the ovum will be viable for more weeks compared to other site of the ectopic pregnancy. Usually we can identify the ectopic pregnancy by USG in the 6th or 7th week of gestational age. During the 7th week, we can able to identify whether the implanted embryo or the ovum is intrauterine or extrauterine. If the implanted ovum is intrauterine, then it is frequently or subsequent weeks it can progress and it can delivery normally by the vaginal delivery or by the LSCS. If it is the ectopic pregnancy from the other sides, if the tubal pregnancy means the tubal, that is the pathogenesis of the tubal pregnancy. If the implanted ovum or embryo in the tube wall is stretched and the blood vessels are passing around the ovum or the embryo, so that by you doing USG or color Doppler, there we can able to see the color of ring or ring of fire around the implanted side of the ectopic pregnancy. If the tubal pregnancy or the other ectopic pregnancy can occur into the abdomen or other side, we can able to identify very less frequent, because the gestational age can be progress, and we can identify at the last itself, and we can able to identify ectopic pregnancy clinically only if the mother or if the reproductive age female has got 2 months or 1.5 months of amenorrhea, that is 6 weeks or 8 weeks junctional. The mother is very toxic and looking very anemic and coming for very severe abdominal pain. These 3 are the things we can identify by seeing the clinical patients. So that we identify by the 3 features, we want to take the USG immediately. We want to identify whether it is ectopic pregnancy or intramural pregnancy, so that we can able to identify it is intra-abdominal or intrauterine or extrauterine or some other site of ectopic pregnancy, so that we can able to identify the cause of the ectopic pregnancy, and we can able to give the drugs to eradicate, or we can able to abort the implanted ectopic pregnancy. Thank you. That is for today video. We covered in this video introduction and pathogenesis. Kindly like, share and comment and subscribe our channel. Thank you.